Hello, my name is Dr. Alex Rutgers. I am the Chief of Pediatric Plastic Surgery and Director of Craniofacial Surgery at JohnsHopkinsAllChildren'sHospital. Today, I would like to speak to you about minimally invasive suturectomy treatment for craniosynostosis. As we discussed in our previous video, craniosynostosis is a condition where one or more of the sutures of the skull are either absent or closed prematurely. This leads to a risk of increased pressure on the brain and an abnormal head shape of the skull. There are two treatment options to address this. Traditionally, the skull of a child with craniosynostosis was expanded and reshaped utilizing cranioplasty techniques. We still commonly perform these procedures with high levels of success. Within the last 20 years, we have now developed more minimally invasive procedures with shorter scars and shorter operative times to address these conditions. This procedure is called minimally invasive suturectomy. Patients who are good candidates for minimally invasive suturectomy can undergo removal of the abnormally fused suture in a 1 to 2 hour operation. Patients typically stay in the hospital for one night after the procedure and have a very low chance of requiring a blood transfusion. We always encourage parents to stay in their hospital with their little ones. The benefits of the operation include the shorter operative time, shorter scar, less time in the hospital, and lower chance of requiring a blood transfusion. The difference between traditional techniques and minimally invasive approaches to craniosynostosis is the fact that removing the suture does not actually change the shape of the skull. Patients undergoing minimally invasive suture treatment for craniosynostosis must commit to 12 months of helmet therapy. Most of you have probably seen babies who have had helmets during their first year of life because of an abnormal head shape. This is most common for a condition called deformational plagiocephaly. We use a similar helmet to guide the growth of a child's head after minimally invasive suturectomy. Basically, what we do as a surgeon is release the abnormal suture so the child's head can grow normally. We partner with our colleagues in orthotics clinics to fabricate a helmet so that we can guide that growth towards a normal head shape. Not all patients are candidates for minimally invasive suturectomy procedures, though. As crazy as it sounds, a baby's head has undergone most of its growth before their first birthday. For this reason, we have to harness the growth of the head early in their life to achieve the best outcomes. The best time for performing minimally invasive surgery for craniosynostosis is between 2 and 4 months of age. Sometimes, in selected cases, patients may be candidates up to 6 months of age. We would like to see your child as soon as the diagnosis of craniosynostosis has been made, or if there is concern that it may be possible, so that we can aid in their diagnosis and offer you the full menu of treatment options to achieve their best outcome. We look forward to seeing you at our pediatric plastic surgery and pediatric neurosurgery clinics to address your concerns and look forward to caring for your child's craniosynostosis.